Welcome everybody. Today we're gonna talk about a new rheumatology capsule. Our capsule today is about a very common and highly prevalent disease. That disease can affect a lot of people among our small family. You can imagine about the national population and the worldwide population. That disease is low back pain. So what is low back pain? Low back pain is the pain that affects the back in the area between the lower costal margin and the upper pelvis, the pelvic rim. And this area represented by a 5 vertebrae called 5 lumbar vertebrae. These 5 lumbar vertebrae represent our vertebral column in the area, but our vertebral column is not one column. It is 3 columns, anterior column, middle column, and a posterior column. The middle column is the column of articulation, the column of the joint. These joints are the facetal joint that connecting the anterior and the posterior joint. These facetal joint can be inflamed because it's structured almost like the wrist, like the elbow, like the knee. It has a synovial lining. It can be affected by synovitis. That's why we call it facetal joint synovitis. Little back pain. Also, the anterior column, each 2 vertebrae separated by the intervertebral disc. That disc can be subjected to stress and lead to prolapse. Prolapsed disc lead to pressure on the nerve, lead to back pain, and sometimes maybe a radiculitis. And this radiculitis is being referred down to the lower limb, what we call sciatica. The 2 columns, anterior and the posterior middle column, are connected by a small bone. This bone is called the pedicle. Sometimes bed fracture or bars interarticularis can get fractured. When fractured, this fracture lead to pain in our back. And this fracture lead to what we call spondylolysis or spondylolysis, displacement of the vertebral body above the other one. This displacement can have different grade, from 1 to 4. 1 to 2 are conservatively treated, and 3 to 4 can be surgically treated. We can have a lot of autoimmune disease can affect the vertebral column in that area, lead to morning stiffness, lead to limitation of movement. So back pain is a very wide disease, have a lot of causes that we need to take care of it. How can we take care of it? Number 1, we have to care about our normal attitude. We have to be in a straight attitude. Number 2, we have to respect our back, not to put our back in a stressful position. We have to know how can get out from the bed, how can carry something from the ground in a right way to avoid stressing our pain and to live with our back in a peaceful condition. Thank you so much.